the Nigerian healthcare has suffered several downfalls. Despite Nigeria's strategic position in Africa, the country is greatly underdeserved in the healthcare sphere. Health facilities, personnel and medical equipment are inadequate in this country, especially in rural areas. While various reforms have been put forward by the Nigerian government to address the wide-ranging health issues in the healthcare system, they are yet to be implemented at the state and local government levels. According to the 2009 communique of Nigerian National Health Conference, healthcare system remains weak as evidenced by lack of coordination, fragmentation of services, threat of resources, including drug and supplies, inadequate and decaying infrastructure, inequity in resource distribution, and access to care and very deplorable quality of care. The communique further outlined the lack of clarity of roles and responsibilities among the different levels of government to have compounded the situation. In spite of the huge development in the healthcare in relation to the last decades, much is still needed to be done in the healthcare system. This is evident in the various health indicators outlined and mortality from several outbreaks of diseases. Although the total expenditure in health amounts to 4.6% GDP, financial managerial competency, besides inadequate funding, remains a major problem. Current statistics show that the health institutions rendering healthcare in Nigeria are 33,303 general hospitals, 20,278 primary healthcare centers and posts, and 59 teaching hospitals and federal medical centers. This represents a huge improvement in regards to the last decade. Nonetheless, healthcare institutions continue to suffer a shortage. It is estimated that in 1960, only 10 to 15% of the Nigerian population was covered by any form of modern healthcare services. Also, services were concentrated in urban areas to the detriment of the rural areas. Consequently, whereas more than 50% of the urban population had access to healthcare, less than 5% of the rural population had comparable access. This pattern becomes more striking if one realizes that about 90% of the population was rural in 1960. The situation has not changed very much today, except that urban migration has increased, further tasking and existing urban facilities, making them ineffective and inadequate.